A long-awaited report on Pharmacare is slated to come out tomorrow. A federal advisory council is expected to release their recommended blueprint for prescription drug coverage. The Liberals will then decide whether to adopt it as their own policy in the federal election campaign. So what should Canadians expect to hear? Daniel Raza is a Toronto-based family physician and the chair of Canadian Doctors for Medicare. He joins us from Toronto. Hi, Dr. Raza. Nice to see you.
Hi, Vashi. Thanks for having me on.
Before I get into the potential recommendations that this panel might make or what the government should adopt, can you sort of lay out for us the problem that needs to be solved?
Yeah, absolutely. I think it's surprising for a lot of Canadians to hear that we are the only high-income country with a universal healthcare system that does not include a universal drug plan. Essentially, Medicare ends once you leave the doctor's office with your prescription in hand and you try and get it filled at the pharmacy. It's a huge problem. There are folks on the street who can tell you the problems that they're encountering on a day-to-day basis. I can tell you that as a family doctor, at the front lines, it's something I have to deal with on a regular basis.
So what kind of options are available? We know that there are everything from single payer to not doing anything. What kind of options do you think will be presented to the government?
Yeah, the two options that have gotten the most attention are one, a single payer plan, so essentially a universal public plan, the way that we currently fund and pay for doctors and hospitals, and that's actually the one that there was the Health Committee in this sitting of Parliament actually recommended. Both the NDP and the Liberal members came together to recommend that. It's a model that the Parliamentary Budget Office has studied, and we've had other peer-reviewed evidence support that model. We also have another model that's being talked about that's a fill the gaps approach. It's something that Quebec has implemented in 1997, where it's a mixed public-private model to also some mixed results.
What are you hoping the recommendation is, and why?
Yeah, I'm hoping that the Advisory Council's report tomorrow is consistent with the recommendations of many reports we've seen, not just in the past 12 months, but in the past years and decades. That the best model to move forward with is a universal public model, and for a bunch of reasons, right? Because when we look at the two major problems in prescription drugs, one is a problem of access. There are 1 in 10 Canadians who can't fill their prescriptions because of costs. People are turning down their hydrometers. People are, skipping meals and other necessities in order to pay for drugs. So access is a big issue, but so is costs, right? We spend the most on hospitals as a country than drugs, and drugs are rising faster in terms of costs than the amount we pay for both hospitals and doctors. So, this is a huge problem. The only countries that pay more for us for prescription drugs on a per capita basis are the US and Switzerland. And, this is not a podium that we want to be standing on.
So what do you think the issue is with political will? Because you're right, there have been so many reports. I think it goes back 40 years, essentially recommending the same thing. So say what happens tomorrow is this advisory council led by Eric Hoskins, a former Ontario health minister, comes out and says, this is what we're recommending, single payer. I mean, we don't know what they're going to say, but say they said something like that. What do you have any faith that the political will is there to follow through on something like that?
Yeah, this is going to take political courage. If we go forward with a half measure, we're not even going to get halfway there. We're only getting partial results. So this is a big problem, and it's going to require political courage and a big step forward. We've seen the NDP put forward a proposal for a universal public plan, and I'm hoping that's what comes out of the advisory council as well, and that the Liberals will adopt that as well as we move into election 2019.
Is the cost prohibitive? I know you mentioned the PBO, and they sort of analyzed how it would eventually benefit, be a benefit, but is the initial cost prohibitive to government's decision making?
Yeah, I think this is actually a myth that needs busting. When you look at all of the credible studies that have been done on this, including the PBO study, we actually save billions of dollars. Right now we're spending upwards of $30 billion on prescription drugs as a combination of both public and private spending, and the PBO estimated we'd actually reduce spending by $4 billion, and predominantly private spending, which is actually a huge benefit for Canadian businesses, both small and large. There are the private drug plans are becoming more and more expensive. So a lot of employers are increasing the deductibles or co-pays or reducing coverage. So this is not just something that's good for patients. It's good for Canadians who need medications, but it's also going to help the bottom line of a lot of businesses that are paying for very expensive private drug plans.
We have only 8 days left in this sitting, so whatever the government decides to do will not be in a legislative way. Likely it will take the form of an election promise. Is this as an election issue a good or bad thing, do you think?
We need to debate this in the election. We absolutely need to make sure that every single political party makes universal Pharmacare, universal prescription drug coverage a priority. This has been the unfinished business of Medicare since Medicare's conception. And the longer we wait, the bigger this problem is going to get. So we really need some political leadership. We need our federal leaders to take some to really grab this problem, this bull by its horns, and move forward with solutions that'll benefit Canadians both with respect to access and cost.
Okay, I'll leave it there. Thank you so much, Dr. Raza. That's Dr. Danielle Raza, Chair of Canadian Doctors for Medicare. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video. Thanks for watching.